How much do you pay attention to what you put into your body? Do you read labels to see what ingredients are in the items you buy? What if the packaging doesn't tell you what the item contains? Then what? Do you still use it? It is our responsibility as individuals to pay attention to what we are putting into our bodies, but it is the corporation's responsibility to relay any possibly harmful ingredients in their products to consumers. The ingredients in tampons and pads are typically made from cotton and rayon. They are put through a bleaching process to clean fibers and for further purification. There are several possible toxins that tampons and pads can contain. As of today, companies are not required by law to disclose all ingredients in their products on the packaging. This is why we must force tampon and pad manufacturers to detox the box and give us answers. Today, 70% of women in their reproductive years use tampons while menstruating. That is 240 tampons per year and 9,600 in a lifetime. What could the ingredients in these products be doing to our bodies over time? It is reported that 9 out of 10 women do not know what their tampons are made of. Researchers are still in the process of analyzing the effects these kinds of possible toxins can have on the body over time. Advocacy for this issue started back in 2008 when U.S. Representative Caroline Maloney of New York introduced legislation to require studies of tampon safety. The most recent version of the bill requires the NIH to study the contaminants and substances used in feminine hygiene products that pose health risks to women who use the products or to the children of women who use the products during or before pregnancy. This is the 10th time Maloney has tried to put this bill into action, and each time it has never left the floor. Tampon and pad manufacturers are not required by the FDA to display the ingredients on the product packaging. Possible harmful ingredients range anywhere from residue of pesticides to adhesive chemicals. An article from the Gothamist of New York Public Radio quoted advocates who were concerned that menstrual products contain toxins, pollutants that can result from bleaching, pesticides, and allergens that could possibly leach to the bloodstream through vaginal tissue and escalate consumers' risk of toxic shock syndrome. This, combined with the unknown of continuous exposure throughout one's lifetime, is disconcerting. The Women's Voices for Earth organization had several tampon products tested for toxins in 2018. This chart shows the levels of a variety of toxins that were found in some of the products tested. While the toxins detected don't suggest dangerous levels, the exposure is still present, and the outcomes are still unknown. According to Dr. Philip Tierno, Director of Clinical Microbiology and Diagnostic Immunology at the New York University Medical Center, and a leading expert on the health risks of tampons, even trace amounts of dioxin are cause for concern because tampons come in contact with vaginal tissue, which is covered in permeable mucous membranes leading directly to the reproductive organs. Since women use thousands of tampons throughout their lifetime, the effects could be measurable. The article from the Gothamist covers the legislation going through the New York court system on this issue. New York has legislation, thanks to Representative Maloney, for disclosure of ingredients. Both the Assembly and the Senate passed legislation obligating makers of tampons, pads, menstrual cups, and period underwear to disclose the ingredients on packaging. Once this legislation goes through, it can help pave the way for other states to bring about their own laws to require manufacturers to be honest about the safety and contents in their products. New York Assembly member Linda B. Rosenthal, who also has legislation in place, said of the issue, "Women and girls have every right to know what they put in and on their bodies, and yet there is currently no requirement for ingredient labeling of menstrual hygiene products, which women use because of biological necessity. Without my legislation requiring packaging labeling, we leave millions of New Yorkers blindfolded in the aisles of drugstores and supermarkets as they consider what products to buy for themselves and their families. Everyone should be an advocate for themselves and their health. Read labels and be aware of what you're putting in your body."